Following speculation that Bodaboda riders are one of the most at-risk HIV groups, Crane Survey undertook the study to be able to inform the health system better on specific information regarding this group. Nearly 700 Bodaboda men above 18 years of age and residents of Greater Kampala were surveyed. The findings showed that HIV prevalence among Bodaboda cyclists is at 7.5%, higher than that of Kampala men in the general population at 4.5%. Among older Bodaboda cyclists 25 years and above, prevalence is at 10.9%, 3 times higher than in younger Bodaboda riders at 3%. More than 25% of Bodaboda riders reported multiple sexual partners, and a good number reportedly engaged in commercial sex. Some Bodaboda riders also reported same-sex attraction and anal sex with both men and women. Some of the Bodaboda cyclists we spoke to say HIV prevalence is higher, not as a result of complacence, but because of too many temptations on the job.
They ride the passengers which are putting on short clothes, the prostitutes at night. When they reach somewhere, the prostitute says, "I don't have money, so you can deduct your money from me."
Omubiri gw'omukyala guno gukoonako gubanga gulimu amasannyalaze gukuleeta okusikirizibwa.
While this data is revealing, experts say it does not change the face of the HIV epidemic in Uganda.
HIV infection among Bodas is higher than among other men in Kampala, but it is lower than in other groups of men. For example, customers of sex workers have a much higher HIV prevalence. Also, regular partners of sex workers, the spouses, the boyfriends, have a much higher prevalence than the Bodas. And men who have sex with men in Kampala also have a much higher prevalence.
The researchers say HIV efforts should still address the most at-risk groups before Bodaboda cyclists. They, however, say more effort should be put on condom use, as 20% of Bodaboda riders said they had never used a condom. The national HIV prevalence rate stands at 6.4%, with prevalence highest among commercial sex workers at 33%. The report recommends peer education programs to reinforce HIV/STI prevention activities, as well as testing and management of sexually transmitted infections. Anna Tkunda, NTV Tonight.